Hello, this is Dr. David Green, CEO of the TEX-PAIN Network. Today's topic is the basics of disc bulges and disc herniations. The normal intervertebral disc consists of 80% water and the rest 20% proteins and collagens. There are two areas of the disc, and the best analogy is that of a jelly donut. The outer, harder part is called the annulus fibrosus. It does have nerve endings, and it can feel pain if it's irritated. The inner jelly part is called the nucleus pulposus. The nucleus has no nerve endings at all. It doesn't feel pain. The disc is an excellent shock absorber. Every time we walk, run, bend, twist, it actually, water gets pushed out as it absorbs the stress, and then it comes right back in. So disc degeneration commonly occurs between the ages of 20s to the 50s due to risk factors such as obesity, smoking, repetitive trauma, genetics, social and environmental factors. This leads to a loss of fluid in the disc, so you start losing that 80%, and then subsequently a loss of height in the disc, and then you can get tiny tears or cracks in that outer part, the annulus, and back pain. You can see a cartoon of that here. Healthy disc, and you start to lose height from the loss of water, start to get some bulging, almost like a tire that's getting flat. Okay. The loss of water in the disc is akin to a tire losing air, and it starts to bulge. So the result is, height loss. An MRI you can see, such as here, you have healthy disc. The white is water. Okay, you start to lose water, it starts to get darker. So some people call it black disc disease, but then here you can see a nice sized disc bulging. 35% of those between the ages of 20 and 40 have degenerative disc disease and no back pain at all. So let's say this person was in that study, and they may have this appearance of a disc bulge and disc degeneration. This person may have no pain at all. Okay? Alright, let's look at how a disc herniation occurs. From the degeneration, you can get a tear in the outer layer, as we know, called the annulus, and it may cause considerable back pain from irritation of nerve endings. Okay? If that tear becomes large enough, then some of the inner jelly can squeeze out. Okay? That in and of itself is not painful, but when it pushes on an adjacent nerve root, that can spark up inflammation and cause sciatica pain. Okay? Terms for this are slip disc, herniated nucleus pulposus, prolapsed intervertebral disc, herniated intervertebral disc. They all mean the same thing. So looking at the symptoms of bulges and herniations, first of all, there may be no symptoms at all. Okay? If you do have symptoms from a disc bulge, it may include back pain. It could irritate an adjacent nerve root and cause sciatica pain, and a person can also have some spasms and aching. A disc herniation can lead to burning and searing pain, pins and needles sensation or some numbness, possibly some motor weakness, and rarely incontinence of bowel and bladder function, and that's actually a surgical emergency. With regards to the treatment of disc bulges and herniations, if it's not too bad, one can simply observe it. That's called benign neglect. Over-the-counter medications can help with mild to moderate pain, including anti-inflammatories and Tylenol. Physical therapy and chiropractic treatment may be very beneficial. Spinal decompression therapy is a form of computerized intermittent traction that has been shown to be exceptionally beneficial for both bulges and herniations. Prescription medications such as a Medrol dose pack, which is a burst of prednisone for 5 days with a taper, can help. Narcotic medications and even non-narcotic pain medications like tramadol, muscle relaxers, neuropathic medications like Lyrica and Neurontin, and then there's topical prescription pain creams. Interventional treatments may include trigger point injections for spasms, intradiscal injections for degenerative disc disease pain, and this involves the needle actually going into the disc and steroid medication being placed. This has been shown to be exceptionally beneficial in studies for months at a time. Okay? The newest intradiscal injections actually involve either platelet-rich plasma therapy or regenerative medicine injections with stem cells. Epidural injections for if a nerve root is being pinched involve medication of cortisone steroid being injected around the pinching. Okay? It doesn't solve the problem, but it bathes this area with a hefty anti-inflammatory medication which can provide pain relief for weeks to months. Over 75% of those with degenerative discs and symptoms are able to avoid the need for surgery. Out of those with sciatica symptoms, because of a pinched nerve or irritation from an annular tear, over 95% are able to avoid the need for surgery. There was a landmark study in 2006 that showed the outcomes of disc herniations at 1 year are no different than those who have surgery. If you can, avoid the surgery, the outcome is the same. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the Dallas-Fort Worth Metroplex area, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.